Have you ever noticed those peculiar little growths on your skin, the ones you might dismiss as just age spots? They hold a fascinating secret, a story of cells that have forgotten how to die. Welcome, my friends. Professor Vitalis here, with your daily dose of wisdom and wellness, where science and experience walk hand in hand. Today, we are delving into the world of these common skin growths. It is crucial that you stay with me until the very end, because I will not only explain the powerful cellular switch that causes them, but I will also reveal the medical breakthrough scientists are racing to create that could make them vanish for good. More importantly, I'll share what you can do about them right now, with a little-known treatment that has shown some surprising results. Let's begin with the problem. We are talking about what are often called keratomas, or more scientifically, seborrheic keratosis. These are very common growths of the skin's outermost horny layer, made up of cells called keratinocytes. A single one of these cells can give rise to a formation that might look like a wart, a mole, a papilloma, or a combination of all three. They can have an unpleasant appearance and sometimes cover a significant amount of skin. While they can develop at any age, they are most often a manifestation of the body's natural aging process. The older we become, the higher the chances that we will develop them. It's estimated that in our later years, a staggering 88% of us will have at least one. So, why do they matter? And what is happening inside our bodies? The good news is that seborrheic keratoses are almost never a direct threat to your health. They are benign. However, they can become irritated. You might catch them on clothing, or they can become inflamed and bleed. The primary danger is more subtle. If you are accustomed to having many of these harmless spots on your body, you might not pay close attention when a new, more dangerous growth appears, such as a melanoma. You might simply miss it. So, while they are not a problem in themselves, they can create a confusing landscape on your skin. Now, let's explore how they work on a cellular level. It all begins with one single keratinocyte. For reasons we are just beginning to understand, this one cell undergoes a genetic mutation and begins to multiply relentlessly, producing a whole family of similar faulty cells. This isn't just random chaos. We've pinpointed the specific mutations. They often occur in the genes that code for receptors for certain proteins, specifically the receptor for fibroblast growth factor 3, and another key enzyme, phosphatidylinosytol 3 kinase. These mutations trigger a cascade, activating a crucial enzyme known as ACT kinase, and here is the key. When ACT kinase is activated, it puts the brakes on cell death. It inhibits a process called apoptosis, which is the body's natural programmed cell death. Think of apoptosis as a self-destruct sequence for old or damaged cells. By blocking this, ACT kinase effectively makes the cell immortal. It no longer functions as a normal skin cell, it just exists to multiply. This growing cluster of immortal cells is what we see on our skin as a keratoma. So, what can we do about them? People naturally want to know how to get rid of them, and it would be wonderful if there were a single pill that could block this entire process. As I mentioned, the core of the problem is the overactivation of that ACT kinase enzyme. And indeed, a great deal of research is underway to develop drugs that act as ACT kinase inhibitors. These drugs would, in theory, allow the cells to finally undergo apoptosis, causing the keratomas to slowly die off and vanish. Such a drug would also be a monumental breakthrough in the treatment of many malignant cancers. I am hopeful we will see these therapies in the near future. But until that systemic cure arrives, our options are focused on local treatments. These fall into two camps, chemical and physical. Among the chemical options, there's a 40% hydrogen peroxide solution approved in the United States, which goes by the name Escada. Another powerful chemical used is trichloroacetic acid, or TCA, in concentrations up to 100%. I must offer a serious word of caution here. While you may find weaker TCA solutions online, this is an extremely potent substance that essentially burns away the growth, and it carries a significant risk of scarring. It should really be considered a form of chemical surgery best left to professionals. However, one study did reveal a promising and safer chemical option. A cream called tazarotene, which is a third-generation retinoid typically used for acne, was tested. In the study, a 0% cream led to a reduction in the size of keratomas in 7 out of 15 patients over 16 weeks. While that is roughly a 50% chance of success and it takes time, it is a much safer approach that avoids tissue damage. This is certainly something worth discussing with your doctor. For larger or more bothersome keratomas, we turn to physical methods. These are things your doctor can perform, from laser therapy and cryotherapy, using liquid nitrogen to freeze the growth, to radio wave destruction. All of these methods are effective. The only drawback is that if you have many keratomas, removing them all can be a lengthy process. This is why it's often best to seek treatment when they are small, especially if they are in sensitive areas like on your face or under your eyes, or in places where they are frequently irritated. Removing a tiny 1 millimeter spot is far simpler than dealing with a large one that has been growing for years. So that is the situation today. These growths are a nuisance, but they are not something to fear. We are on the cusp of exciting new treatments that target the root cause, waiting for that magic bullet drug that blocks oct kinase and brings us all a bit of relief. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.